Hello, everybody. This is Pam and Linda and Mary, and welcome to Conversations with Your Nurse Advocate Consulting. And tonight is episode 6 already. I can't believe that we've done 6 episodes so far. And tonight we're going to be talking about adult onset diabetes. And we'll talk about that in a minute. A couple of things I wanted to just do a couple of announcements. People have been asking some questions. First of all, I'm going to throw this link up here on the screen. This is a link. We're going to show some forms that as we move forward and start talking about different disease entities, or we're going to be creating forms that are going to be available for you as cheat sheets. And so this is the link that will get you on the email list and get you on, and being on that list is going to get you the forms that we already have created, which we're going to talk about. And we'll also get you forms that we create in the future and just remind you about what's going on with your nurse advocate. And our emails are no more than once a week, so we're not going to flood your email box, but we just want you to make sure that you get access to the forms. So that's what this link is. And then the next thing I wanted to talk about is one of the other questions that we've been getting is, how do you pay for our services? And so that's pretty difficult to say up front, because we have a whole list of services and everybody's needs are individualized. So what I encourage everyone to do is go on our website and click on, contact us and schedule a 15-minute that's complimentary. So it's a free 15-minute discovery call with us. We'll kind of talk about your needs. And in that 15 minutes, we're going to get a pretty good idea of what services you might need from us. And then we can come up with a quote and better be able to share that information with you. On the flip side of that, we do have 2 monthly membership programs. We have a $49 membership program, and we have a $99 membership program. And so with those programs, they're different tiers of services, but it's kind of like having a nurse at your beck and call. So it's kind of like having us as your private nurses, that we're ready to go whenever you are. But those services include monthly trainings. For the $49 a month, we provide resources, ideas for you. You as the client implement the plan of care with our help with resources. We're going to have a private Facebook group where we can answer questions on specific trainings. You'll have a free 15-minute discovery call per month. And then when we go into the tier 3, or the $99 a month, it's the same as the other tiers, weekly trainings and education, but we're going to help you. We're going to do more of the heavy lifting. We're going to be implementing, if you want us to do more of the work and implement your plan of care and do more of the legwork for you, this will be the tier for you. Also, we're going to have the private Facebook group, the private specific trainings. You're going to get 2 15-minute discovery calls per month. We're going to assist you with getting implementing an advanced directive, and also we'll have 1 complimentary a la carte service that will be included in that. So those are that's kind of a ballpark, of what's available for you. So before we move on to diabetes, Mary or Linda, do you have anything you wanted to say about any of those things?
No, just looking forward to working with everyone.
I would suggest, okay. Pam, going on the website. I would suggest that they have more questions to go on the website and see, because there's quite a bit of information on there for different services that we can provide. So I think the website is a great resource when there's questions on what do we do and what don't we do.
And absolutely. And so I always throw the link up there usually on our call. So here's the website is for you. It's also in the chat. So feel free to go on the website. You're going to get quite a bit of information, as Mary suggested. So with that being said, we're going to talk about adult onset diabetes. What's the difference between adult onset diabetes and regular diabetes? Well, type 1 or insulin dependent diabetes is something that you get much younger in life. You can actually get it as a child, and you are insulin dependent. Your pancreas, which is the organ that produces the insulin, which the insulin allows the sugar to get absorbed into your body and turned into energy so that your organs, your muscles, and your brain and everything else can function. So we're not going to talk about that. That's something that you will be insulin dependent. There isn't anything that you could do to change that. It is what it is. And so we're not going to spend our time talking about that. But what we are going to talk about tonight is adult onset diabetes. And so what's the difference? Well, the difference is that adult onset or type 2 diabetes is that occurs usually later on in life. Unfortunately, with the obesity crisis that we're seeing people in their 30s, as young as their 30s, already contracting diabetes, when normally we wouldn't see it until sometimes 40s, 50s, or even 60s or older. And what that does is a lot of diabetes type 2 or adult onset diabetes is a result of poor choices and poor lifestyle choices, such as eating high sugar and carbohydrate meals over a long period of time. When we're younger, we don't think that those things are going to catch up with us, but oftentimes they do, and we see it in the form of diabetes. One of the risk factors too is if you had gestational diabetes, or if you were told that you had diabetes during your pregnancy, that also puts you at a 50% greater risk for getting adult onset diabetes than if you did not have gestational diabetes. So if you had that, you want to also be careful, because you're going to be more prone to develop diabetes later on. One of the questions we get asked a lot is, is type 2 diabetes, can that be prevented, or can it be reversed? In many cases, absolutely. This is something that you're going to have to work with your provider, your doctor, but oftentimes, and I've seen many, many examples whereby losing weight, controlling the amount of carbohydrates that you have in your diet, or the complex sugars, white flour, white rice, sugar, by controlling those and eliminating or cutting down on those, you're able to lose your weight, and which decreases the amount of insulin that your pancreas have to use, because when you type 2 diabetes, the pancreas that's eliminating the insulin to process your sugar, we've just worn it out. We've worn it out by those eating habits. And so it doesn't produce as much insulin as it used to, so it can't manage the amount of sugar and carbohydrates that you've normally been using. So you have to be able to cut back on that. I've seen people be able to get off insulin. I've seen people to be able to get off oral medication, but that is something that you have to have, that you work with your provider with, so that they can keep a close eye on you during that process. Usually what happens, lifestyle changes are very hard. So your doctor may be very willing to go along with you. None of us want to go on medicine if we don't have to, but your provider will oftentimes give you an opportunity to try lifestyle changes to lower your blood sugar. One of the tests that they do to determine how far along your diabetes is, so to say, is you have a blood test. It's called a hemoglobin A1C. And what that is, it's a blood test that is, the result is an average of what your blood sugar runs in your body over about a 3-month period of time. So anything over 7 is considered diabetes. You get into that low, mid 6s and things, that's when you're starting to look at, they may call you pre-diabetic, or a glucose intolerance. They haven't quite called you diabetic yet, but you're approaching that. And usually you want to be in the 5s. Usually if you're in the 5s or below, you're doing well, and you're not considered a diabetic. And that can change. So once you start changing your eating habits, or you can be put on an oral medication. One of the most common diabetic oral medications that you can go on is metformin. Metformin helps lower that blood sugar, and part of the revolving door, and one of the most difficult things with people with lifestyle choices and trying to control your blood sugar by dieting alone, is it's a vicious cycle. The more sugar you have in your blood, the harder it is to lose weight. So you have to get the blood sugar down before you can even start to lose weight. So it takes time. One of the things that you can do to speed that up is exercise. Exercise, when you're exercising, that requires your body and your muscles to burn up more sugar. So it takes more blood sugar, it takes more sugar out of your bloodstream and to use for your muscles. So that helps lower the blood sugar. Also water, drinking, non-calorie beverages also helps to wash that blood sugar, that extra sugar out of your blood. Because before we move on into symptoms, anything like that, Mary or Linda, can you think of anything that I forgot in describing what type 2 diabetes is?
Yeah, I have one question. Can type 2 diabetes be genetic?
Yes, that's a great question. Usually when you have a family history of diabetes in your family, you are more likely, or you are at a greater risk of developing diabetes. So yes, if you have a family history of diabetes, you need to be much more careful. You are more likely to contract diabetes. Yes, thank you. Anything else?
Yes. What is the percentage of the adult population that right now is currently considered pre-diabetic, or that has that A1C that's borderline? Mm-hmm.
That's a great question, and we'll see if we can get that answer right away. I know with the whole obesity crisis, the numbers I'm expecting will be quite high.
Mm-hmm.
That's a great question, if we can get that answer. And what is the percentage of diabetes in the United States? It looks like overall 34.2 million Americans, or 10.5% of the population, have diabetes. Nearly 1.6 million Americans have type 1 diabetes. And let's see what we have for the type 2 diabetes. And let's see here. That's not coming up here. Okay, it looks like, okay, here we go. More than 84 million people ages 18 and older are pre-diabetic. That's 1 out of every 3 adults.
That's what I thought.
So that's,
I thought that was really high number. Yeah. Mm-hmm.
Yes. So that's huge. I didn't realize that it was that high.
Pam,
so
what A1C,
one of the reasons why diabetes is, yes.
Sorry, Pam. What's the A1C when they
Mary?
begin? What is your A1C when they start to call you pre-diabetic? Is it anything over 5 or
about 6.4, 6.5? No, in mid 6s, mid 6s, 6.4,
okay.
6.5.
Is that would be pre-diabetic or diabetic?
And then anything over.
Okay.
Yes, pre. Anything over 7 is considered diabetic. I mean, that's hands down. They will diagnose you with diabetes. Okay. So, and that's a great question, because the higher your number is for your A1C, the more what they call uncontrolled. So the higher the number, that means your blood sugar is, so say for example, at about a 6.2, 6.3, kind of approaching that pre-diabetic range, your average blood sugar in the morning is around 130, and normal is between 70 and 110. Some say 70 to 100. It depends on what clinic you're at and what lab values they're looking at. But when you start hitting that pre-diabetes range, your morning blood sugar before eating is around 130 to 133. So why is diabetes such a big deal? You go on medicine, you control your blood sugar, or you go on insulin, you can eat whatever you want. What's the big deal? The big deal is not many people will pass away from diabetes, but they will pass away from other conditions caused by the diabetes. And what I mean by that is diabetes, it causes heart disease. It leads to heart disease, high blood pressure, kidney disease, poor circulation. That's why many people that are diabetic, you hear about them getting amputations, whether it starts out with toes, and then it could go to feet, then it could go to lower leg, because it affects your circulation. Diabetes affects every organ in your body. And the closer, the more you can keep your blood sugar to normal, the less of those side effects of diabetes that you're going to get. And people, blindness, I mean, diabetes can cause, you to go blind. There are so many things that diabetes affects, and people just need to understand is that you'd almost rather have another type of chronic disease because that you can treat that one disease. But when you have diabetes, you're not only treating the diabetes, you're treating a potential mirage of other health conditions, chronic health conditions that you could have for the rest of your life caused by the diabetes. If you can prevent your diabetes or keep it well controlled, you'll be much, much better off. Mary or Linda, anything you want to say about what kind of the effects of having diabetes is?
No, the longer that you have that you've been diagnosed with diabetes, the more it is left uncontrolled, the harder it is to walk away from chronic illnesses or the sequela of the diabetes itself. The more prone you will be to a stroke or to blindness or to kidney failure, and the harder it will be for you to recover from them once you do get your diabetes under control, because it's been left uncontrolled for so long.
And, people, when you talk about scenarios, when you look at renal failure, what does that look like? There's a lot of diabetics that end up on dialysis, and that's not, that's a struggle. I mean, to go to dialysis, if you're fortunate enough that can do home dialysis, otherwise, you're going to a dialysis, center 3 times a week. It's just, we just want everybody just to take diabetes very seriously and do what you can. One thing I didn't mention, and where the amputations with the circulation starts, sometimes it starts, you get the diabetic neuropathy, and that's something that we forgot to discuss. And what that is that diabetes causes nerve damage. And so the further away your extremities, the more you feel like your fingers and your toes. So for example, here's someone with diabetes that goes outside, is, walking around in the cold, or, gets frostbite or steps on a nail and didn't feel it because of your neuropathy. Well, now you have a wound because of your diabetes. The wound doesn't heal because it impacts wound healing. And then the wound gets to the point where they're having difficulty treating it. You've got dead tissue. If it gets into the bone, that's where we now have to take off, say a toe, or an amputation is when that infection gets into the bone, and that's called osteomyelitis. So there are just so many complications, to diabetes. Now that we've scared you.
Well, I have one comment. I have one comment. Yes. Oral care, seeing your dentist every 6 months, foot care, seeing a podiatrist every 6 months really helps with that preventative care that diabetic individuals need to keep themselves healthy and prevent some of these long-term effects. So those preventative measures of just basic keeping your feet clean and dry, and looking at your feet for open areas and sores, and making sure that you dry them well after bathing, and that you make sure that your nails are cut appropriately so you don't get ingrown toenails. Those simple things will help prevent a lot of the infections. And getting your teeth cleaned every 6 months, and getting cavities filled, and getting that care done routinely every 6 months will help prevent a lot of those infections, just by very simple maintenance preventative care.
The other thing to include in there,
that's a great
Linda,
point too. We talk about how
the other thing to include, you guys, sorry, Pam, is eye doctor appointments.
Mm-hmm.
It's really important too, because like you said, Pam, it can cause blindness. Yes. So definitely want to see your eye doctor at least once a year.
And, and that's why we say, what Linda was bringing up, the foot care too. That's why we recommend you get your toenails cut either by a podiatrist or at your doctor's office, because, if you do have an ingrown toenail or you do cut yourself, I mean, there's increased chances again for those even those small wounds not to heal properly and turn into bigger wounds, and then they become more problem. One of the things, how people say, well, how often should you check your blood sugar? Well, everybody's going to have a plan by their provider, by their doctor, on how they want you to manage your blood sugar. So your doctor may, depending on where you are in the course of your diabetes, the doctors may have you check, at least once or twice a day if your diabetes is normally well controlled, or they may have you checking it 4 times a day, before every meal and then at bedtime, especially if you're taking, insulin, so that we can look at your highs and your lows and see where you're at, so that the doctor is well aware of making any adjustments. It's extremely important for you to keep a log of your blood sugars. And every time you go see your doctor, and you're going to, that they're going to check, on how your diabetes is doing, bring your log with you, because that's the only way that your doctor can effectively adjust your medications, is if the doctor can see, what your ranges are and where your blood sugars are, in the morning before you've eaten, after meals, to see how high it gets and how, and how if it comes down properly after a couple hours after eating, and then at bedtime. So, please, I know nobody likes to poke themselves, and I know there's other gadgets out there, please, those are conversations you need to have, with your doctor, so that they could pick out the right equipment and the right plan that is best for you. So please be diligent in keeping a log of your blood sugars. One of the things we brought up, and I'll just pull up the link again for our forms. And so one of the things is we do have available, and I'm going to see if we can put it up there a little bit, is our sheet on our Stop and Go Light diabetic form that is available. We just asked for your email address so that we could send them to you, because they're in a PDF, and I can't post those here on Facebook. So we're glad to be able to email those to you complimentary. But it's kind of nice, the form, you and your doctor to pick the proper range where they'd like to see your blood sugar. And then we have a caution. If your blood sugar is starting to get too high, if it's over 200, what should you do? If your blood sugar gets over 300, what should you do? There's room for you to put comments on there if your doctors make any specific requests in managing your diabetes. We have a sheet if your blood sugar goes high, and we have a sheet if your blood sugar gets too low. So we hope that you will find that, a valuable tool. And one of the other tools other handouts that's available for you, I'm going to just kind of put that up there too, is we've done our medication list. And so that's available for you to have as a tool as well, by getting on the email list for the forms. And that goes into, we've got pictures for morning, noon, evening, bedtime, and then as needed medicines. And it's big print, and you can put your medications in there and hope that will also help you, another tool to help you manage your health. With that being said, is there anything else, Linda or Mary, that you can think of that I forgot to discuss in general about diabetes?
Symptoms.
Oh, great. That's perfect. I'm glad you brought that up. So one of the things that we need to think of is when your blood sugar is starting to get too high, one of the things that you're going to notice is that you're going to be thirsty. You're going to have increased thirst. Also, you're going to be urinating more frequently. You may be getting up more times during the night than you have before. And those are the 2 major symptoms that you're going to notice when you could have some blurred vision as well. And those are kind of 3 things that you may notice if your blood sugar is running higher than normal. One of the things that you need to do is if it is, make sure you're drinking a lot, but make sure that it's 0-calorie liquids, that, water or, a beverage that has no calories, because if you definitely don't want to add more sugar into that when you're already high. And then the next thing is if your blood sugar gets low, that's when we can get ourselves into, you can get yourself in the hospital either way, but more quickly, if your blood sugar is running low. And that's usually if it's below 70. But again, if you've been a diabetic for a long time and your blood sugar normally runs high, your low might not be 70, your low might be 100. So you have to be able to recognize the symptoms of a low blood sugar. And that's really kind of like a fogginess, weak or shaky. You know, and in the beginning, you will have feelings of hunger, but the lower your blood sugar gets, the less responsive you are, the more confused. And basically then you could actually, you know, go unconscious, you know, from your blood sugar being so low. The most important thing is while you're still alert enough to eat or drink, you want to get some quick acting sugar in. If you have your glucose tablets that's prescribed by your doctor, or you want to have some kind of juice. You can even take a glass of apple juice or orange juice, put a packet of sugar in there, get some quick sugar into your system as quick as possible. And then every 15 minutes, check that blood sugar until you're starting to feel better and that your blood sugar is coming up. So every 15 minutes, take something else. And if you find after a few times, like 2 or 3 cycles of that and your blood sugar is not coming up, that's the time to go to the emergency room. Same thing with if your blood sugars, you can't get that blood sugar under 300 after a couple of hours, then you also need to go to the emergency room and or at least call the clinic and get advice, you know, on what to do. And these are kinds of things that are listed on our checklist. So it's amazing how quickly you can come back when your blood sugar is low, but you want to just make sure that you get ahead of that before you're not alert enough to be able to eat or drink, because once it gets to that point, then there's nothing else you could do then is to call 911 and get to the emergency room. Linda, is there anything you want to add to that?
What about sweating? What is that usually a sign of? Is that
yes, that is another symptom of low blood sugar where you get diaphoretic. And so yes, thank you. That goes along right with those low blood sugar symptoms.
What about an odor to your breath? Like if you have some type of an odor to your breath.
Yes, and that's usually a fruity odor, and it's very noticeable, and you will see that with high blood sugars. So when your blood sugar is getting high, you may have that fruity odor to your breath. Anything else you can think of?
No.
Okay. Well, I didn't see that we had any questions come up. So I just want to thank everybody for coming on. And I always want to remember to thank all the people that watch this on the replay. We do have quite a few people that come back a little bit later and watch it at their leisure. So we're very appreciative of you to come back and check on us at another time. And so don't forget, if you'd like to get on the list for those forms, go ahead and just click that link and give us your email address. We'll be happy to send those out to you. So with that being said, I'm going to say good night. Linda?
Good night.
All right. Thanks, everybody. Oh, Wednesday, we are having a special guest. And so more to come on that. I always think of these things at the last minute. We will have more information to come. Look for information for that tomorrow. But it's going to be, I think, a nice visit with someone who runs an agency. And what they do is they support caregivers at the home. So they do care for the caregivers. So I think that will be a good conversation for us to have. So with that being said, everybody have a great Sunday, and we will see you soon. Take care, everybody. Bye-bye.